I will ask you to introduce yourself, please.
Yeah, I'm Professor Praveen Vashist. I'm heading the Community Ophthalmology Division in AIMS, New Delhi. And I'm happy to say that we are working with CBM for last 8 years. And in fact, I'll be the principal investigator for Project Roshini, which we plan to do with CBM. Yeah.
Thank you. So let's start from the Indian context. I would like to look into the impact of social disequalities on eye health, basically, in India.
Yeah, in fact, I would like to say that we conducted national blindness survey recently in India. The prevalence of overall blindness is reduced significantly in India. But when we see the diversity, the blindness is much higher among women population. The blindness is much higher in the people who are among the people who are illiterate. In fact, it is nearly 3 times higher among illiterate. It is much higher in rural population. Nearly 70% of Indian population reside in rural area, and the blindness is higher in that. And the most importantly, it is much higher in among disabled population. In the district where we got the disability segregated data, I am here to mention you that the overall prevalence of visual impairment was found to be around 13%. But when we saw the people who are actually having various kind of disability, among them the prevalence of visual impairment was as high as 29%. So you can understand that India is a place where, though we have improved in overall visual impairment or blindness component in last 20 years, but still there is a lot of like differentiation in prevalence among the people who actually need more services, the women, the illiterate population, the rural population, the people living in tribal areas, underserved areas, and also the disabled population.
Let's talk a bit about children. How do visual impairments affect their daily life?
Yeah, no doubt. In fact, children are important because if in case if child is having blind, then they have to live entire life as a blind. That it's affect the productivity also. As far as blindness is concerned, the commonest cause of blindness among children is corneal opacity. And nearly 37% of blindness in India is because of corneal opacity. And this is one disease actually where we cannot treat without, if somebody is donating some their corneas, only then these people can be treated. So what we need is to prevent this kind of blindness, prevent infections, prevent injuries. Then you can reduce the blindness among children. As far as visual impairment is concerned, I think as globally, refractive error is the leading cause of visual impairment among children. In fact, the study shows that 90% of visual impairment among children is due to refractive error. And what we need, just a pair of spectacles. Unfortunately, we are not able to provide that pair of spectacle to school going children. I must say that recently, as per our survey, we gave a number to Government of India that in India, nearly 20 million children, they require spectacles every year. But as per the national program, they have kept a target of just 1 million spectacles. That means just 5% of the actual need has been kept as target. The reason is very clear. We don't have human resource and infrastructure to provide such services. And that's why just 5% of the target has been kept in our country. So what we need more and more optometrists in the country who can go to schools and provide refractive error services so that these children who are actually visually impaired, and that is leading to their school dropout. They are not sustaining schools, leading to school dropout, and effectively you can understand the productivity, economic burden in the country actually.
So let's talk about a possible solution or at least a contribution to this issue.
Yeah, sure. This Roshni project is actually a brainchild of CBM with along with the RP Center. We are working with CBM since 2015, and in RP Center AIMS New Delhi, what we have done is we have strengthened our low vision services under the CBM project, and also outreach program in terms of comprehensive primary eye care services. That was a very productive program with very good outputs, and what we felt is that such kind of program should be replicated in other part of the country also. So under this project Roshni, what we have planned is we'll be taking 4 other institutes which are All India Institute of Medical Sciences, the new AIMS, and also regional institute of ophthalmology. And with the 4 such institutes should be taken in the initial phase. And what we'll do is we'll provide 2 major components. One is the comprehensive primary eye care services in their catchment areas, and also about the strengthening low vision as well as rehabilitation services in their base hospital. So this is the aim, and beside this, we'll also plan to do some kind of research activities where we'll be conducting surveys, pre and post surveys about the status of blindness and visual impairment in those areas, and also some kind of surveys on disability, that is the assistive technology, rapid assessment of assistive technology in those areas, so that a baseline as well as the end-term indicators, we can actually assess the improvement being done in this area. I'm happy to say that we plan to cover nearly 400,000 people, to provide services to 400,000 people under this project Roshni in next 3-year period. And as per the WHO initiative, that it should be a people-centric approach, integrated people-centric approach. So we plan to go in the same way in this project, Roshni.
How do you think that this project will contribute to break the cycle between poverty and disability?
We all know that disability lead to poverty and poverty lead to disability. It's a vicious circle actually. The plan on this project, Roshni, is not to stay in hospital and provide service. As I mentioned, it's a people-centric approach. So our aim is to identify disabled people in the community and provide at least eye care services to all kind of disabled people. Let me tell you, at present in our country, hardly 10% of the disabled, they get low vision and rehabilitative services in country. We aim to increase that number so that beside providing treatment to these people, we should also look for further rehabilitation. If the children are there, then we'll look for educational rehabilitation. If adults are there, we'll look for their vocational training and further employment. If we achieve these things, then we can definitely say that they will, after getting chance of re-employment, then we can reduce the poverty among this population.
And just a final comment about CBM, in your opinion, since you mentioned that RP Center has been partnering with CBM for a long time.
Yeah. In fact, we are partner for last 8 years, as I mentioned, and we know how CBM works. This is one sincere organization who are actually working for the disabled population and also for visually impaired. And probably I suggest if somebody want to use their money really for philanthropy purposes, then probably CBM is one organization. For them, they can donate money, and that will be effectively used to overcome the burden of visual impairment and also to provide services for the disabled people. So I request all of you, if you're there in any part of the country, in the Western world or in India, please come and donate for CBM so that that money can be effectively utilized for the betterment and the quality improvement of the country. Thank you very much. Thank you.
Thank you very much, Dr. Vashist.